Toothache is the worst type of pain you can have. It's equivalent to childbirth, what mothers go through. Also, it's equivalent to your stomach ache when you have your appendicitis. It's extreme. I'm gonna talk in this video about what kind of pain you can experience, what caused this type of pain, and what can you do to get rid of this pain. Helpful instructions at the end of the video. I'm Dr. Olga Dolghier, Palm Valley Pediatric Dentistry. I'm board-certified pediatric dentist and laser dentist. So let's talk about pain. Most of you, I hope, never experienced toothache, but if you did, you know what I'm talking about. Let's break it down. Number one type of pain we see a lot of parents or kids can complain about dull pain. What is dull pain? You feel like there's a constant pain, sometimes even pulsating pain. You just cannot get rid of it. It's annoying, it's there, and no matter what you do, it's just there. It's not extreme, but it just reminds you that you need to do something. Next type of pain is sharp pain. That type of pain is extreme. You cannot sleep at night, you're awake, you're trying to put something on your gums. A lot of patients tells me you're trying to take all the ibuprofen, Tylenol you can possibly find, and you still cannot beat that pain. It's a sharp, extreme pain. You literally can crawl the walls. That's how much it hurts. A lot of women actually compare this to childbirth. On a personal level, I had severe toothache when I was pregnant with one of my kids. And it was so bad that I could not sleep. I could not do anything. I was totally dysfunctional until I got to a dentist and got taken care of it. So it's really, really significant. Next type of pain is throbbing pain. Throbbing pain sometimes associated after procedure. For example, you had tooth removed, you had something done to your tooth, and it's just kind of annoying, low-grade pain, which actually can get better and better. In the fourth type of pain, we're talking about tooth sensitivity. Tooth sensitivity is when you're doing hot or cold and your tooth just screams at you. For example, you took a cold sip of water and it just shocked you in the face. Or you're drinking something hot and it starts annoying, picks out and then kind of goes away. Or some people report sensitivity of all the teeth when they do bleaching of their teeth. So let's break it down. What causing this different type of pain and what can you do to help yourself? So every time you have throbbing pain and you had dental procedure done, then you probably should address with ibuprofen or Tylenol. If you have throbbing pain and you did not have any type of procedure or anything done, you might need to see actually help from a dental professional and see, is that a cavity, is it tooth fracture, does it need additional intervention, additional attention, that's why it's bothering you. Then dull pain sometimes tells me that you most likely have a deep cavity and is getting to that portion of the tooth where blood vessel and nerve is, and it kind of slowly irritates the nerve. Your body still kind of recover from it, but it's just there, it's annoying and it's present and sometimes gets better but then comes back. That's your dull pain. Usually deep cavity or periodontal disease can cause this type of pain. And the sharp pain, the one when you're crawling the walls, when it's worse than your childbirth, that's the one when actually the cavity and the bacteria in the cavity penetrates the pulp chamber where the blood vessel and nerve is, and it actually irritates the nerve of the tooth. You can feel literally like pulsation. You can feel extreme annoying pain. It's so significant that you have to seek attention, and a lot of people can't even function with that type of pain. I know I couldn't when I had to have root canal done actually. And then sensitivity depends. Sensitivity overall, if it's one tooth sensitive, sometimes you can have sensitive tooth after you had a filling done. For example, had white fillings are photopolymers. They shrink with light. So most of us, after we have fillings done, you're gonna have that kind of sensitive tooth for a while because the conduction of cold and heat of the filling is different from your tooth. So no matter how well the filling is done, what kind of material it was placed, it still might have that little bit of sensitivity after procedure is finished. Also bleaching. Now it's nice and popular to have that beautiful white smile, but it costs you discomfort. That's why we advise for you guys to use Sensodyne toothpaste prior to bleaching for 1 week and then bleach your teeth while you're using that toothpaste, because it's actually desensitizing your teeth. What's happening on microscopic level? The peroxide in your bleach trace actually penetrates enamel and goes inside those little tubules and bleaches it. So the pressure from the fluids and dentin cause that sensitivity. It does not damage your tooth. You should be okay with that. It's not damaging, but it does create overall sensitivity. Usually people complain about cold sensitivity. They say, oh, I went outside and I just did, and everything started hurting. And that's true. Bleaching would do it to you. So using toothpaste prior, during, and after would help with preventing this sensitivity. So those are my 4 main pains which you can experience and what can cause a result of the pain. So they can transfer. For example, the dull one can become sharp one. And also next step after you experience the severe pain, sometimes it goes away. So technically you had that bad day, you technically cannot function. It's hurting so much, but all of a sudden it stopped. You're not getting better. I have a bad news for you. You're not getting better. Your nerve just died. And when your nerve dies, you feel nothing. But then you have a secondary phase of this infection. Now all of a sudden you woke up in the morning and you have a swollen face, or you have an abscess on your gum tissue. So abscess is like a pimple on your gum. So what happened? Tooth died and the infection licked through your bone. If you have a good, strong immune system, it's probably localized and you just have an abscess in the mouth. But unfortunately, sometimes it's so severe that it can spread to different parts of the body, different fascias, and then you can have really, really big, severe swelling, and it can actually when it can go even further, and then you can have those complications which I was telling you about when patient actually has to be hospitalized. So now let's talk about what to do if you have this different type of pain. If you, for example, cannot go to a dentist that same day. So if you have throbbing, dull pain, you might probably take ibuprofen and Tylenol. It would help temporarily with discomfort. You can alternate between 2 every 3 hours. You start with Tylenol and ibuprofen and so on. The over-the-counter medications are actually anti-inflammatory and help you with discomfort. If you already have an abscess, you would probably benefit from taking ibuprofen, Tylenol, and also rinse your mouth with salty warm water because it provides drainage. That would be helpful. Sometimes you can apply topical over-the-counter numbing medication. Usually it's a benzocaine. Don't overuse it because it has a lot of side effects and it temporarily takes care of that pain. But at least you can go through the night and see your dentist in the morning after. So those are little hints what to do. I would not recommend put ice or hot on your face. Sometimes works, sometimes doesn't, sometimes it can make things worse. So just ibuprofen, Tylenol, rinsing mouth with the salty warm water, and seek dental care. But prevention is the key. Don't forget brushing and flossing, seeing your dentist on a regular basis. Don't push everything away and say, oh, I'll do it later, doesn't bother me, doesn't need to go anywhere. And then you end up with this type of pain because ignorance causes you a lot of problems. So important to keep things up to date. See your dentist every 6 months, making sure you're brushing and flossing, eating well nutritional diet. That's extremely important. And don't forget, some of you always say, oh my God, dentistry is so expensive. Dentistry is not expensive. Neglect is. Thank you so much for watching. And if you like to share your experience, what kind of toothache did you have? Did it go away? What caused the pain? Can't wait to see your comments. Thank you.